Hello everybody, I'm Dr. Michael Zdilla, licensed chiropractor, and I would like to talk to you a little bit about stretching. Some of these stretches that I'm going to talk about are very useful in helping you become more energetic, have less neck pain and less headaches as we work on a computer, whether that's home or at the office. This has become a big problem, a big issue right now, especially with my patients that are doing a lot of online work at home. And I just wanted to refresh your memory on how to do some of these stretches. They're very easy, but make sure you consult your healthcare provider before doing these stretches. So, 3 muscles that I would like to talk about today are the trapezius, Levator scapula, and it's not necessarily one muscle, but it's a muscle group called your suboccipitals. So, one thing that we have to know and realize with stretches is that if you are not holding them like a statue, you're not stretching. So back in middle school, back in elementary school, maybe in gym class, we were taught, well, you would see all the kids doing this where they would bounce. You'd touch your toes and you'd bounce, 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 bounce. When you bounce during a stretch, you are not stretching. It's more of an exercise, and I'm not going to get into the science behind it, but it's not really a stretch. Imagine a rubber band. You have a rubber band. Well, let's do this. Rubber band, and we take it and we go like this. You're going to have the same size rubber band. If you take the rubber band and you pull it a little bit further than you were, and you hold it there for a time, and then you let go, the rubber band's going to be a little bit bigger. It will actually stretch. So that's what we want to do with our muscles. So we have to figure out a way to make these habits throughout your day. A lot of people will ask, how many times should I stretch? Well, maybe you find 3 times through the day. Maybe you set up a habit where there's a person that you're talking to online or an email that comes in, something very random through the day that you can associate with your stretches. Maybe you take a phone call, and on that phone call you do a couple of your stretches. Try to make it into a habit, because habits, they're hard to break, right? They're hard to form, but once you form them, they are very hard to break. So think about trying to make these stretches into habits. Now, we have trapezius. Trapezius are these muscles up here on your shoulders. What you're going to do is you are going to take your hand, reach across over your head, so your hand is above your ear, and you will pull very gently. We want everything to be strong but comfortable. That is very key, because a lot of people want to overdo things. So strong but comfortable. So hand over your head, hands above your ear. Your elbow is out to your side. It's not angled. It's right out to your side. And what you're going to do is you're going to pull real gently this ear down towards your shoulder. Strong but comfortable. If this is strong but comfortable, hold it there. If this is strong but comfortable, hold it there. If you can go all the way down, hold it there. Some people like to be a little bit more aggressive with stretching, but it's not necessary. Sometimes people will take the opposite hand, hold underneath maybe your chair, and then do this. And that will stabilize the shoulder down, so you do get a little bit more of a stretch. You're welcome to try that, but remember, everything is strong but comfortable. Now, remember, you're holding for 30 to 40 seconds. 30 to 40 seconds, and absolutely no bouncing. So that's trapezius. And then we can transition from trapezius, this one, to levator scapula. So what I'm going to do is I'm going to turn and look down towards my hip. I'm going to take my hand and reposition it to the back of my head, and my elbow is going towards my hip also. So I went from straight on, hand over my ear, elbow across, straight across, like this, to looking down towards my hip. My hand moves to the back of my head. My elbow is going down to my hip. And now I'm feeling a stretch right around here. This is levator scapula. So you are taking and holding this for 30 to 40 seconds. And you're going to do both sides, of course. And it depends on what kind of routine you're setting up. So if for some reason you only do this once a day, then maybe do 2 times on each side or 3 times on each side. If you are scattering it through the day, which this is what I prefer, this is going to make your life a lot easier online, at your desk, at work. You want to split that up through the day, maybe once on each side throughout the day, like 3 or 4 times. Okay. Now remember, you consult your healthcare provider to see if this is the right recommendation for you. Now, the third stretch that I'm going to show you, this is very, very helpful for people that are looking down all day long, for people that suffer from headaches and fatigue. I'm going to be talking about stretching your suboccipital muscles. They're really tiny muscles that live right underneath the back of your upper neck. Real tiny. So these little tiny muscles, when you're looking like this, these aren't the only muscles you have in your neck. I get it. You have large muscles that hold your head and neck in this position. But these little ones, they get fatigued and they can cause a lot of irritation, right? So headaches, neck pain. So what we're going to do is we're going to stretch these. These muscles do not follow the rules. They're not held for 30 to 40 seconds. We only will hold them for about 6 seconds. This is the wrong way to do this. I'm showing you the wrong way first because most people do it the wrong way. So I'm showing you what not to do right now. You're not going to tuck your chin like this. That is the wrong way. The right way is I use 2 fingers on my chin, and what's going to happen is we're going to flatten our neck. So our cervical curvature is like this. I'm going to push back and it's going to flatten my neck just like this. Pushing back is I'm using that loosely. I'm going to use my 2 fingers to help stabilize my jaw. I don't want to cause a jaw problem. So be very careful when you're doing this. Now, the wrong way, the right way. See how I'm basically flattening my neck, right? It looks a little funny, right? You could do this at stop signs, stop lights. Well, stop sign would be 6-second count, right? But these are only done for 6 seconds. You don't hold that for 30 to 40 seconds. Some people may not even feel a stretch up there, but you are stretching these very little important muscles, and it's going to help alleviate a lot of neck pain potentially. So here we go. 6 seconds. So here is the routine. Trapezius, hand on the side of your head above your ear, elbow out to the side, straight across, 30 to 40 seconds. Am I bouncing? No, I'm just holding it. Then I turn and look down towards my hip. I move my hand to the back of my head. My elbow is going towards my hip, and I pull gently. Remember, strong but comfortable. Levator scapula. And then I'm going to turn to the side. We're going to flatten our neck, basically. 6 seconds. If you don't have time to do the whole routine, do them in stages. So do your trapezius, 1 on each side. Maybe you're taking a phone call. Do your levator scapula. Phone call. Just a break, right? You're listening to an online meeting. And then our little suboccipitals, holding it for about 6 seconds. And we can do these stretches throughout the day. Make sure they become a habit. So you don't want to go and do 50 of these things a day, right? 3 to 4 times a day is pretty adequate. You'll find what works for you. Now make sure you are discussing your routine with your healthcare providers so you can come up with a plan that works for you. I hope this has helped. I'm Dr. Michael Zdilla, and subscribe to our channel, and I will talk to you soon.